All right, good morning. Thank you for joining us for the last day of our Winter Intercession Career Development Academy. For our first session today, we have Sarah Herrera, who's going to be talking with us about the transition from being a student at Bloomberg and what that looks like to actually going to professional practice. So with that, Sarah, if you want to introduce yourself.
Absolutely. Good morning, everyone. I'm so excited to be here with all of you on the other side of school, now working, as Olivia said. And I'm really excited to share my journey with you this morning. I am originally from Westchester County, New York, so I grew up about 30 minutes outside of New York City, which was wonderful as a child. I got a suburban life and a little bit more quiet, but 30 minutes away was basically the world at your fingertips, and that's something that I think really shaped my experiences growing up. I currently reside in Charlotte, North Carolina. As much as I love New York and my heart will always be there, I was excited to live in a place and work in a place that was a little bit more slowed down. So Charlotte is a growing city. It's a developing city with lots of opportunity, but it is a little bit quieter than New York, which makes it a very nice place to live. I am a 2020 graduate of the Hopkins MAS program in patient safety and healthcare quality. And I'm really excited to be sharing my experiences with you. I know that a lot of you are probably in different programs at the school. And I really love that there are so many options available to study at Hopkins and so many ways to kind of create a unique path for yourself. I knew that I wanted to sort of specialize a little bit in patient safety and quality improvement, and the program allowed me to do so. So I'll talk about that a little bit as we proceed. And I am currently a Novant Health employee here in Charlotte, North Carolina. So I work for their Institute of Safety and Quality. I am a performance excellence coordinator, which is just a lot of fancy words to say that I work with metrics. And again, I will get into that a little bit further later, how I ended up there and what that work looks like day to day. I thought I would share some fun facts with you all too, so you can get to know me a little bit better. I have a pet cat named Sydney. He is one of my favorite things in the world, and he loves to go outside. So we have some unique walks together. I am an avid reader. So if you're on Goodreads, look for me. Let's do a little book club together. I set a challenge for myself every year to read 100 books. And I'm proud to say I am doing so much better at this challenge now that I am no longer a graduate student. It makes it a lot easier. And I also love fitness. So when I am not working in the field of healthcare, I do enjoy teaching fitness classes both locally and nationally. I'm a virtual instructor for a brand. So love to get my body moving when I am not sitting in my office chair here. So let's talk a little bit about my journey and how I got to where I am. I was an undergraduate student at Sarah Lawrence College in New York. I did not go far from home to do my undergraduate studies. And something unique about Sarah Lawrence is that there are no pre-planned programs for students. Everyone graduates with a degree in liberal arts. And on the surface, that might not sound like it would mesh well with going into healthcare, but I was really able to develop my degree and focus on areas that I was passionate about through one-on-one work with my professors. So over the course of my time at Sarah Lawrence, I took some really great classes that focused on healthcare policy. I did some deep dives into insurance, what that looks like around the world. And I also had some really fantastic internships. And this was a huge part of what shaped me into the person that I am today. One of my internships was at the March of Dimes and their national office. And I worked there on a variety of projects that were all surrounding prenatal health and ensuring the birth of healthy babies. This was a great internship program in that I was able to see what it looked like to be on the other side of healthcare. I wasn't there in an office working with patients directly, but a lot of our work focused on policies and procedures that doctors and hospitals could put into place to help ensure that mothers were healthy. I also did find out that the March of Dimes did a lot of work with clinics that were local, trying to implement different experimental programs, such as a family history toolkit app that could be brought out into a clinic and help patients understand their background. And I loved this because I knew that I really didn't want to be a clinician. I didn't want to be a nurse. I didn't want to be a doctor, but I wanted the work that I did to have an impact on patients every single day. I wanted to know that I was making a difference. And for the first time during this internship, I saw that you could do that without being a clinician. We were still touching so much of that day-to-day work for the patients and for the providers. I also had an internship at a company that would become my first job, Montefiore Medical Center and Albert Einstein College of Medicine in the Bronx. And it was when I was at Montefiore interning for the first time that I was introduced to the concept of public health. And looking back, I always tell people I'm almost embarrassed at how long it took me to be introduced to the field of public health. I was about 18 years old when I started interning in the Bronx. And as I mentioned earlier, I kind of grew up in that suburban lifestyle. I was very fortunate to have two parents who had pretty blue collar jobs. My mom was a police officer and my father worked at a sugar refinery. But despite that, we had insurance. We went to the doctor regularly for our well-child visits. And it hadn't really crossed my mind that that wasn't always the norm for someone. It hadn't crossed my mind that it wasn't easy for everyone to go to the grocery store and easily access vegetables, fruits, things that kind of enabled you to have a healthy diet. To me, it was normal. It was part of my everyday life as a child, and I just took it for granted. And my eyes were open during this internship. I mean, honestly, it was like I did get dropped off at the first subway stop in the Bronx, was kind of told you need to get around, you need to visit these clinics, you need to do this work. It was a shock to my system, and it was a shock that I needed because I was so excited then about the work that there was to be done. I didn't want to be seeing the world through those rose-colored glasses anymore. I didn't want to take for granted all that I had at my fingertips. I wanted to work with these communities who had trouble accessing and find creative ways for them to be healthy. So my first role was at Montefiore, and I was hired on by them immediately following my college graduation, and I worked for their reproductive genetics department as a research assistant. I really enjoyed this role. We did a lot of work surrounding cardiogenic conditions in families, around different genetic defects that were seen in certain populations more frequently. And our work was really designed to try and ensure, again, healthy babies. It kind of goes back to the work I did at the March of Dimes as well. And I really enjoyed being in the community there in the Bronx and seeing that we were able to treat such a wide variety of patients. People coming from all walks of lives would come to Montefiore to receive their care. It was also a good opportunity to dive deeper into research, as since it was associated with a school of medicine, all of our work had to be done rigorously. We were frequently working with our internal review boards and making sure that all of the research that we were doing was ethical and was approved and then could be moved on to publication. So what a great introduction immediately following college into what it was like to work with patients, work on various projects, and also be part of that research engine. It was a really fantastic start. About 6 years ago, I decided to make a big move, and I moved to Charlotte, North Carolina. This really was just for a change of pace. Something I tell people when they ask me why I moved here is you used to walk into McDonald's in New York, and there would be a sign up at the cash register, and it would have their average. How many seconds had it taken them to serve their customers on average? And the number just was so crazy low. It would be something wild, like it takes us 15 seconds to serve our customers at this McDonald's. And I just realized that everything was coming too fast. I didn't necessarily need McDonald's in 15 seconds. I didn't really need McDonald's, period. Let's be honest. I wanted to be and make my life in a place where people were willing to take that step back and slow down so that things didn't get missed. So I moved to Charlotte and I took a role at Atrium Health. At the time, it was still known as Carolina's healthcare system, but I worked for their simulation center. And this is where I get to show you guys my true inner nerd and what really got me excited and revved up about quality improvement. I did a project at Atrium that was all focused on where is hand sanitizer and hand soap placed in an ICU room. And it sounds horribly boring, I know. It got me excited. I went into the ICUs and I did room analysis of every single room to figure out where the hand soap dispensers were placed, where the hand sanitizer dispensers were placed, and were they being used properly by those on the unit? And then deeper than that, were they not being used because people didn't want to wash or clean their hands? Or were they not being used because they were not set up well for people to use them? And that's what it comes down to. At the end of the day, most nurses, most doctors, most healthcare staff would never go into their day saying, I just don't want to wash my hands today. I don't want to make sure that I'm keeping my patients safe. They want to do it. We don't always set them up for success as the people who are behind the scenes, making sure that hospitals are built properly or rooms are set up properly. And I would find that in some rooms, sanitizer was behind a door. You had to walk in, creep around the door to clean your hands. It wasn't the same room to room. So a doctor could be seeing 3 patients in a row, and in every single room would have to find and look for a new place to see where they could wash or clean their hands. It was not effective. And we were able to increase that unit's hand hygiene skills by simply creating boards, kind of like a large poster board, but harder material, that we posted the soap, the sanitizer, and gloves on and put in a standard location in every single room. And that seems so simple. It probably just seems like, well, why didn't we think of that sooner, or why wasn't it done from the start? But until we stopped and took the time to really explore what was going on, we just didn't know. And to me, that was my first introduction to true quality improvement and how simple and how straightforward it could be. And I knew I wanted to do more. So I applied to the program at Hopkins. I was part of the inaugural class of students who joined in this program. And I absolutely loved the program. I had the chance to speak with some of the leaders on this call before you are all admitted. And I talk the program up whenever I can, because what it did for me as an applied science program was provide me with the tools that I need to now be successful as a professional. So I like to say I had a toolkit. It was pretty sparse at the beginning of my time at Hopkins. And as I went through classes, I was adding more tools to use as a professional. So, hey, let's talk about lean process improvement. Hey, now that's your tool. Let's talk about PDSA cycles. Hey, now you have that tool in your toolkit. And now as a professional, I can access all of those tools and put them into use. And what was also great about this program is that it was a lot of practical work. So most of us were working while we were still in this program. My classmates were nurses, doctors, respiratory techs, all sorts of people who were working in healthcare. And we could put these tools to action as students, as workers, and bring our experiences back to the classroom. At the time, I thought I was starting what could potentially be a real long-term career at the University of North Carolina at Chapel Hill and their Nutrition Research Institute. And this is a really cool institute that is off-site. It's actually not in Chapel Hill, but about an hour and 15 minutes away in Kannapolis, North Carolina. And their scientists are bench scientists for the most part, who are focused on precision nutrition. Their goal, I think long-term, is that you'll be able to walk into your doctor's office, get your blood tested, get all of your results analyzed, and your provider could then tell you, hey, you need to eat these specific things to help you be the healthiest, and not from a broad perspective like eat a Mediterranean diet, because for the most part, that's going to work well for everyone, but as specific as you should avoid certain foods because even though they're healthy and they're great overall, your body doesn't respond as well to them, or your body doesn't process them as effectively. I was really excited about this role. I loved working for the Nutrition Research Institute. My coworkers were fantastic, and the work that we were doing was impactful. A lot of what I did was around community education. So I had the chance to plan events, to work with our community members, to get them educated, to answer their questions. It felt like I was making a difference, but it felt a little bit like something was missing. And at the time, I was coming close to the end of my studies at Hopkins, and I knew that it might be time to make a change. So I share this picture because it makes me laugh. Where do we go from here? I was a 2020 graduate of Hopkins. 2020 might not have been the ideal time to graduate from a program based on quality and safety in healthcare. And as I sat in my living room during our digital convocation ceremony, I was excited, but I was very nervous. It was May of 2020, so we were really early on in the pandemic. As a New Yorker from birth, even though I wasn't living there at the time, the stories that I was hearing from my family and my friends were scary. I think a lot of us were just scared about what healthcare was going to look like. And I still wanted to work in healthcare. I still wanted to make a difference. I just knew that at the time, it probably wasn't the best moment to make that transition. Everyone was in crisis mode. Everyone was just trying to get through a very, very hard time. It wasn't really the moment to look for jobs. So I waited. And that was hard because I was in a role where I felt that I could be doing more. I felt like the knowledge that I had received really could be put to good use during this time. And as someone who's very type A and who always wants to be doing more and learning more, holding back in that moment was difficult, but it ended up paying off. And in December of 2021, I took a role as a clinical excellence performance coordinator at Novant Health. So Novant's in the background here. Novant is a large hospital system in North Carolina, if anyone is from the area, with bases in Charlotte, North Carolina, in Winston-Salem, North Carolina, and more recently, the coastal market in Wilmington, North Carolina, and then all sorts of spots in between, as you can imagine. What do I do day to day? Because my title is a little bit broad. Most of my work is based with Novant Health Medical Group. So our family medicine, our internal medicine clinics, and our quality metrics. So we have a whole list of quality metrics. I thought about showing them all to you, but I realized it was a lot and I would just focus on a few. But we pull these metrics that we hold our clinics and our physicians and our providers accountable to meeting from both internal goals, external resources. So a lot of it is in some cases tied to our payers. But at the end of the day, our quality metrics are designed with our patients in mind, because the higher we can perform on these metrics, the better our patient care is going to be. So a few sample projects that I've worked on over the last year. On the left here, cervical cancer screening. Hugely important. We do a really great job here in the US at identifying cervical cancer early, and it is something that we don't see as many long-term deaths from because of our screening process, but that only works if we're screening our patients. We found at our system earlier in the year that our screening metrics were not hitting the target we wanted them to be at. We wanted clinics to be at least 70% cervical cancer screening among their eligible patients. And so we decided to see what was going on. And kind of like going back to that project that I focused on where we were looking at hand hygiene and where the devices were, it turned out that a lot of our patients were getting cervical cancer screening. The results just weren't filtering back through to our electronic medical record system. So a really easy fix for cervical cancer screening in our case was starting to explore external records. So using our medical record system, could we look at another system and see that, hey, our patient actually just happens to go to an OBGYN down the road at another system. Their results are here. We just need to pull them in. Or can we search through LabCorp results to get those test results and just ensure that our patients are having their screening? And in many cases, it was that simple. We were able to increase almost 5 percentage points from January to December simply by taking the time to track down those results and to remind our providers and our clinics that they were there. Take that extra time to look for them and ensure your patient's care. Breast cancer screening here in the middle is another big one. This is one that's a little bit trickier, in my opinion. Oftentimes, it's really difficult for patients to go and get a mammogram. The scheduling isn't always easy. So if we have a patient who works a really busy job and is in an office or at a factory from 9 to 5 or even longer and has childcare to deal with on top of that, it's hard to get them in for an appointment. Oftentimes it takes a month or two to get an appointment scheduled, and we're just really not set up for the best success for these patients. So what can we do? We can send out a mobile unit, and our team will work with clinics to say, hey, look, we have a lot of patients who need these mammograms. When can we bring this unit that's convenient for them? Can we come in the evening when people are out of work and get them care? Can we come on a weekend and make it simple for them to come? Can we make it so that if they have a child with them, they can bring them for the appointment and not feel uncomfortable? And we try to break down those barriers. Last but not least, I'll touch on colorectal cancer screening. And if you recognize this guy on the right, he is from Cologuard. We have a lot of patients who are intimidated by the idea of getting a colonoscopy, and we understand it is a little bit of a scarier procedure. It is our gold standard, so we're always going to encourage our patients to get a colonoscopy when they're eligible and when it's time for them to do that. But if they're not willing or if they're not able at the moment, we have other options like Cologuard, which is an at-home test that they can do. So we try to work with patients to make this as easy as possible, sending it directly to their home, sending them all of the instructions and video care that they need to know what to do, and following up with them. So trying to meet our patients exactly where they are, rather than making it difficult for them to access care. I've done a lot of work over the last year in Lean, getting my green belt through our system and working on some collaborative projects. I mentioned studying Lean at Hopkins, we did, and I had done Lean at another healthcare system as well, but it has been great to start working here at Novant with Lean. We are currently in the process of implementing team huddles across our medical group, and I'm a part of that implementation team. And then on a lower level, I've just used Lean to improve some of the processes that I work on a monthly basis. So if there's a report that needs to be run, is there standard work in place to ensure that the same steps are followed month to month so that if I were to fall off the face of the earth tomorrow, my coworkers could step in and run that report and run it effectively, run it smoothly and not hit any roadblocks on the way. That's usually my goal when I'm working with Lean. How can I make things as effective as possible? I work on operational safety and represent my quality team on the operational safety calls that our system has twice a week, where we identify any potential safety problems and roadblocks and escalate them to whoever they need to be heard by to make sure that they are solved in a timely manner. And then last, I also work on our antimicrobial stewardship program. A lot of the work I'm currently doing is surrounding penicillin allergies in children and making sure that we are appropriately labeling people as penicillin allergic or not, because in many cases, what someone might call an allergy is not an allergy. And if we can safely medically prove that it's not an allergy through testing, we're able to then give the patient less dramatic antibiotics when and if they need them, compared to having to go out of our way to prescribe something different that might be more powerful, that might not be as good for their system in the long term. So I love being a part of that program as well. It all comes down to the why behind the work. And I mentioned at the beginning, and I'll mention again now, our quality work comes back to our patients each and every time. And I love being in a role where I am not a provider, but I'm able to bring the expertise that I gained in this graduate program to work every day with me and use that to impact the lives of our patients. I did some numbers earlier in the year. I was working on a project that focused on Medicare annual wellness visits for our patients. And I had a clinic that was really struggling with getting these visits done. Their percentage was super low. I want to say they were somewhere near 40%. The goal was for them to be at 65. It was not looking like they were going to get to that goal, but they jumped about 20 percentage points over the course of the year. And when I did the math and I went back and looked at how many patients that was, it was hundreds of patients who were being seen as a result of them just putting in the work to improve. So no, they weren't at goal yet and they were still working to get there. But if they hadn't put in any work at all, hundreds of people would not have gotten their medical visit that they should have every single year. And I look at it that way. We're impacting those lives day to day. They are real people. They are real results. So what can we do to make sure that they're getting the very best from us? So what's next for me? And I like to include this just because I don't want you to feel like finishing graduate school and getting your first job is the end of the road. It is not. It is just the start of a journey that you can continue to learn, to grow through your system, through the public health department you work at, through future education. So just know that that is not the end goal. You're going to continue going. For me, this looks like getting my certified professional in healthcare quality certification this year. I'm going to be sitting for that exam at the end of the month. Continuing education, I take advantage of learning opportunities at Novant, and I'm also considering coming back to Bloomberg for a Doctor of Public Health program to continue to learn and build leadership skills. And finally, growth through networking. And this is key. This is something you can start doing now as you do prepare to enter the workforce. I love to network, to meet people who are within my field, who are outside of my field, because healthcare is so collaborative and it's always evolving and it's always changing. So think about the connections you can make and be creative with it. It's not just networking with your fellow students, your professors, or people in your field. It's, hey, you're at the student library and you run into someone who works in technology and maybe they haven't even thought about healthcare yet, but there's someone you can connect with, and down the road, who knows, there could be some great technology on the horizon that in the future, a collaboration will come to be, and you can be a part of something like that through networking now and building those connections. So just sharing some of my advice as you transition from school into the workforce, a big piece of this is finding balance. I'd like to encourage you to be selective. Something that was really difficult for me when I was in that waiting process of trying to find a new role after graduation is that it can be tempting to apply to every single open role that you see that you are even remotely qualified for. The temptation is there because number one, you want to work. I mean, we all do enjoy what we do, but we also want to have a paycheck and build a secure life. So it can be really tempting to just start applying like crazy, but stop, take a step back, and see what these roles are really looking for. I am not a believer in dream jobs. I think that if you place all of your thoughts and all of your ambition into finding your dream job and you get that dream job and find that it's difficult or it's really hard to go to work and your coworkers aren't as friendly, you're going to kind of have your heart broken. So I try not to think of it as a dream job, but I try to think, what's a role where I can thrive? What is a role where the skills that I bring to the table are going to balance well with my coworkers and are going to help me to be successful? So be selective. Look at roles with that in mind. Is it somewhere that you see yourself growing? Is it somewhere that you see yourself learning? Is it somewhere where you see yourself making strong connections? On the same point, say no. If you go through an application process and there's just something that doesn't feel right to you, there's a big red flag, or there's just a couple of small little orange flags, our gut is smart. Our brain is smart. If you hear that voice shouting at you that maybe this isn't the right fit, don't be afraid to say no and look to something that does feel like the right fit. On the same side of that, as you finish your schooling and as you kind of go through the process where things get stressful with your schoolwork or balancing it with whatever job you have now, don't be afraid to say no to social commitments that don't serve you, but also don't be afraid to say no to taking on more schoolwork that maybe is not in line with what your goals are. It's okay to say no to certain opportunities. It's really tough when you're a go-getter and you're trying to do your best, but sometimes you just need to say no, no, thank you. It's not for me right now. And you can always have that opportunity to come back to things later. Sometimes it feels like you'll never get that chance again, but I promise you, you'll get that chance or a better chance, and you'll serve yourself in the moment. Come back to things that you love as well. As you finish school, as you apply for jobs, I mentioned at the beginning, I love to read, and I had to stop reading as much when I was in grad school because I just didn't have the time. When you have the time, when you have a spare moment, if there's something that you love to do and you've had to put it to the side for a little bit, come back to it. It's going to fuel you. It's going to make you feel better when you have to return to the realities and the responsibilities that you have. And this is my 4P approach to the job application, the interview process. First and foremost, prepare. Really research the role that you're applying for, research the organization that you are applying with, even research your interviewers. I find this to be so helpful, and I feel so much more comfortable when I do this because I feel like I've put a face to a name. I know a little bit about their background and where they've been. In my role applying for Novant, it was the funniest thing. It was not a direct person that I was going to be working with, but Novant does broader interviews where they might bring in someone from a team that you'll associate with every now and then. And it turns out that one of my interviewers was going to be a fellow Hopkins alum. And I didn't know it until I looked on LinkedIn and I saw that. She had looked me up on LinkedIn and seen it, and it was something we were able to connect with in our interview. So find those little connections. I found that there were people who had similar changes in background and similar educational experiences to me, and it just made me feel more comfortable. Like I was talking to someone I knew a little bit, not a stranger who was judging me. I also highly recommend a website called Ask a Manager. This is one of my favorite workday websites. You know, the end of the day where your brain's starting to get fuzzy and you just need a quick 15-minute brain break. I head to Ask a Manager. She compiles questions that readers write in about the workplace, anything from applying to jobs to absolutely wild coworker situations that you would never guess could exist, and how to handle them, how to handle transitioning roles, maybe from student to worker or from a worker to a leader. And she always does so with great grace and humor. So I recommend that website as well. Do a quick search there for interview tips, resume formatting tips, and you can find just a wealth of information that will serve you on your job hunting journey. Practice. Run through interview questions with your friends, your family members, even yourself, like in the car as you're driving. This has helped me so much over the years. when I was in college, I actually competed in the Miss New York pageant system for scholarship money. And I would just make my sister, I'm sorry, I'm an older sister, and so make is probably the correct word. I'd make my younger sister ask me questions in the car, at home, just throw any question my way, even if it wasn't necessarily directly related to the topic of the interview, for example, to keep me really on top of answering questions in the heat of the moment. So practice those questions that are related to your job skills, but also just practice talking about yourself. Inevitably, the question is going to come up in an interview. Hey, tell me a little bit about yourself. And don't find yourself going blank. You are an expert on you. Have 1 to 3 things in mind that you can pull from and talk about and feel comfortable talking about. You'll ease into your interview and you'll feel so much better. Polish. Always have someone take a second look at your materials. I do this with my resume. I do this with any writing samples or project samples. Even if I feel really, really good about it, I'll ask someone to take a quick look. Sometimes it really is just a family member. Both my sister and my mother have done studies. They're both in different fields. My mom is a retired teacher and my sister is a social worker, but they're familiar with academic writing and what it should look like. So I ask them for help and I give it in return. So be a resource to your friends, and I promise they'll be happy to review materials for you to make sure they're at their very best. And last but not least, pamper yourself. Find a way to relax and unwind before interviews. I use the word pamper, but this does not need to be a spa day. Perhaps for you, the way that you relax and unwind is by playing video games or going on a hike. Like, pick your thing, get into your best mindset before that interview, and you will feel so good going into it and hopefully be very successful as you apply for those roles that suit you, that will grow you, and that will challenge you to become really truly the next generation of incredible healthcare leaders. So with that, I just want to say thank you so much for having me. I have included my contact information here. I would love to serve as a resource to any of you. If you ever have questions, if there is a way that I can support you, please reach out. And I am delighted to take any questions that you might have right now as well.
Yes, thank you, Sarah. Please feel free to put your questions in the chat if you have them. You also can utilize the raise your hand function and then come off of mute as we call you to be able to ask any question. Sarah, I do have a question for you. First, let me say I really love to hear about your experiences, as well as you talking about the 4 Ps. It's an approach that I feel like, simplifying it that way is something that students can really kind of grab on and be able to utilize. So within that first P, you talk about preparing, and you also talking about doing some research for the interviewers. Can you share a little bit about what that looks like for you as far as like your interpersonal relationships or networking? Has there been any benefits that maybe you've seen in your career where networking has either provided some opportunities or just helped you grow professionally?
Yes. So from the time I was in undergraduate program until now, I have seen the benefits of networking. My first role at Montefiore actually came from a connection at the March of Dimes, where I was an intern. One of the providers there had heard that I worked with members of her team. We hadn't worked together before, and she invited me out to coffee to talk, to meet, and to get to know one another. And by the end of that coffee date, I had an invitation to interview for a job. So I think it's all about really taking the connections that you can make, focusing on making a strong impression, and being open to those little meetings and being open to the time that they take. And I think that it can be really hard when you're in school, or if you haven't done it before, to feel comfortable in networking situations, because we all, for example, just came out of a pandemic where we stayed home and stayed within our pods. It can feel weird to be going out into the world with the intention of meeting strangers and making connections, but it's finding that reminder that you have that common interest. So if you're on LinkedIn and you're looking at their profile, for example, people list their interests. They list where they went to school. They list what they study. They list what they're doing now. You can kind of take a quick scan and find a common interest. So one example that happened to me in my last job search is I found out that one of the people I would be interviewing with had also worked for the field of development, which is what I did at UNC. I was technically a development worker doing community outreach, and she had come from that background too. So I knew in my head when we started to talk to each other we both knew healthcare, we both knew patient safety, but we also knew development, and we could kind of link up and talk about that. So it's really, in a way, a comfort to you as well that, yes, you're going out, you're meeting strangers, you're taking time, you're doing something different, but we have these commonalities that are so much more frequent than you might even think that they are. And it's a great way to just make that human connection.
Absolutely. Thank you. I personally think that networking is for everyone. I think that sometimes there's this idea that you have to be a really extroverted person to make those connections, and that's not the case. You definitely can connect with people and still be true to who you are. And I think from that standpoint, it's a skill, and it's something that, as you're sharing, the more you do it, the more you're going to become comfortable with it. So thank you for that. I also want to ask you, just kind of thinking about, your transition and being in healthcare. You've mentioned the pandemic. And so we, of course, know that there have been a lot of changes because of that. Can you share a little bit more about how you feel that it has affected your work specifically in healthcare?
Definitely. So coming into my role in quality improvement, one of the first changes is that from day one, I was a remote worker. We were not going into an office. We were not collaborating as frequently in person. Everything was digital, from our meetings to even working with the clinics. I would find myself frequently on Zoom like this with a clinic administrator versus going to the clinic in person. And when I do go to the clinics in person now, it can be difficult. Some clinics are still very much closed off and following more strict COVID protocols. So on a baseline, all of our clinics at Novant Health still are masked. And I think that that is wonderful. And that is the rules that we follow. But some of our clinics are still following more strict social distancing procedures where their lobbies are very, very sparse. There's not many chairs. They're following procedures where they are not allowing anyone but the patients back into patient care areas. And in many cases, that even includes me as a quality improvement team member. Yes, I'm there to the benefit of the clinic, but from a health perspective and from the policies that they have in place, my being there is not to the true benefit of the safety and the well-being of their patients. And so often we have to adjust. Can we do this digitally? Can I come in before patient hours? Things are starting to get a little bit more loosened up, so to speak, now, where more clinics are allowing those visitors when they're safely taking precaution. But it changed the game quite a bit. And in quality improvement, it also changed the attitude and the habits of our patients. So a patient who might regularly come in for one of their screening visits during COVID might have put that visit off. So this past year became a time where we needed to do patient outreach and get them back into the clinics, get them back feeling comfortable with their providers and back on track with their screening. Because as terrible as the pandemic is, it was really tough. I'm sure you've all heard stories for patients who were facing chronic illness or who were facing a cancer diagnosis. We do not want the pandemic to get in the way of the care that they need, nor do we want it to get in the way of being able to screen for future problems. So it's been coming back to find what we all call that new normal, and especially for quality work, just letting our patients know that we are putting in the work behind the scenes to make sure that they are well cared for and that they are not being exposed to danger by coming to our clinics, but making sure that they know that they can come in and get back on track for their screening. So it's been a huge part of my day-to-day work.
Absolutely. Thank you. I think it's really nice to know that this is work that you can do from a virtual space, for students to kind of have an idea of what that looks like. And even thinking about, your degree program. So you have your master's in applied science. Can you speak a little bit more to that and just maybe either the skill sets or some of the courses that you've taken that you felt like you've really been able to apply to the work that you do?
Absolutely. So one class that comes to mind is actually our capstone final class, where we took everything we had learned over the course of the program and put it into action in a quality improvement project. And I apologize, my cat would like to join us for this work, so we'll get him out of the way. He loves quality improvement. But I focused on patient safety handoffs between emergency room physicians and the floors that they were sending their patients to potentially. And by doing that, I was able to look back over the courses that I had taken and identify different tools that would help with this. So we looked into certain aspects of research design courses, how would we design a program like this? Do we need to do any sort of focus groups with our providers to hear about what's going on before we then implement a performance improvement tool to help them improve their communication? So what I thought was unique about being in the applied science program is we spent a lot less time on the theoretical and a lot more time on the practical application of those theories that had been developed over the years. You know, we kind of knew that they were there, we talked about them, but when it came down to it, we put it to practical good use. And that was the big difference in this program. And it's what really appealed to me about this program, because I knew I wanted to leave graduate school prepared to work and with that skill set ready to go. And so I found that to be incredibly, incredibly helpful. And that is one of the examples of just kind of putting those skills to use.
Definitely. Thank you so much. I think it's important to highlight that because I definitely think that there's so much value within the MAS degree program. But it's one that, you know, a lot of times people are hearing about the MSPH or, you know, getting their MPH. So I think it's really good for students to kind of hear the places that you can go and the things that you can do and the skills that you can develop with that. So thank you so much for sharing. Any other questions?
I have a question, Olivia. This is Jeanette, Sarah, and just an amazing presentation. So thank you so much. And my role is to provide career advising for our current MPH students. And as an alum of Hopkins, I have a shared perspective with them. What's the best way that you would say for someone to reach out to you for networking? Or any other Hopkins alum? And do you think that reaching out to other Hopkins alums, say through LinkedIn or another space such as that, is a good way to build their network?
I do, Jeanette. I think it's a great way. So I have used LinkedIn to connect with some of my former classmates, some teachers. I respond to LinkedIn messages when they are sent to me. I also respond to email. So I have, since graduating, gotten involved in some of the alumni networks where we receive emails regularly. There is actually a Microsoft Teams group for alumni interest networks to get together and collaborate. So I think that digitally networking in all of those manners is so incredibly helpful and so incredibly useful in this day and age. I would really encourage everyone to get involved, because I actually did not get involved with that immediately following graduation. It took me a couple of months and I regret not getting involved sooner. So when they start to email you and say, hey, you can join this alumni network, you can join this Microsoft group, get on LinkedIn, do it. You will make some incredible connections.
Thanks so much.
Okay, well, if there aren't any questions, I just want to thank you again, Sarah, so much for your time, for sharing your experiences and your story. I think that you have shared some very valuable negative information. And so I just want to thank you for taking the time out to do that. Everyone that's on the call, I also want to thank you for joining us. We will be having a few more sessions for the remainder of today, so please feel free to join us there. Our very next session is actually going to be at 11, and we're going to be talking about those first 90 days and beyond. So what exactly does it look like to make that transition? So hopefully we'll see you over there at that next session. Thank you again, everyone, so much for being here with us.